Hello everyone. Thank you for joining the online presentation today. We're still presenting online. That reminds me of the impact COVID-19 has in our day-to-day life. I would like to quickly introduce myself. I'm Mohammad Amran Hossen, PhD student at the Faculty of Integrated Technologies, University, Brunei, Darussalam. And I will be presenting my work on social distance monitoring using a low-cost 3D sensor, which could potentially be deployed for automatic social distance monitoring. This presentation is divided into 5 main sections. Firstly, I'll present the brief introduction of the COVID-19 pandemic and its current situations. Secondly, I'll share the challenges of existing methods for social distance monitoring. In the next section, I'll present our approach for social distance monitoring, which is followed by results and analysis. Finally, the presentation will conclude with key findings. COVID-19 was first reported in December 2019 in Wuhan, China. On March 11, 2020, World Health Organization has declared it as a pandemic after it has spread across 114 countries. Since then, many countries have enforced strict border controls and lockdowns. Since January 2021, many countries started rolling out vaccine. As of July 2021, 27% population of the world has received at least a single dose of the vaccine. The COVID-19 pandemic has led to a dramatic loss of human life worldwide and presents an unprecedented challenge to public health, food systems, and the world of work. The economic and social disruption caused by the pandemic is devastating. To date, most of the school business remain closed. While a few countries are slowly opening up their domestic business and travels, it's facing increasing challenge with emergence of new variants. Since the beginning of the pandemic, researchers have suggested various methods, which includes using the face mask, isolation, quarantine, social distancing, and community containment to slow down the spread. According to the United States Center for Disease Control, the number of affected people increases significantly without taking steps to slow down the spread, and healthcare systems face increasing difficulties to provide facilities for everyone. This graph shows the number of affected people over time, where X represents time and Y represents number of people affected at a given time. And the dashed line represents the available healthcare facility. Social distance plays a vital role to slow down the spread. In general, social distance is the practice of maintaining greater than usual physical distance for preventing transmission of an infection by limiting the human physical contact, particularly at public spaces such as shopping centers, parks, school, college, universities, medical centers, airports, as well as workplaces. Researchers propose various methods for social distance monitoring, using frontal or side view video sequences, while a few researchers suggested using the overhead positioning cameras. Typically, deep learning-based methods with clustering and distance-based techniques have been used to identify human and monitor the social distance. However, RGB image-based approaches are sensitive to camera calibration, lighting condition, known ground planes approximation, and pixel-to-depth estimation. In order to apply in real-world situation, an efficient system is required, which is robust and doesn't require calibration for integration. Here is a simple visualization of data captured by a 3D camera and image captured by a 2D camera. In our proposed method, we use the depth images to identify human in the scene, and we extract the 3D skeletal joint position from the depth images. From all the joints, we derive the shoulder center joint and extract the distance between individuals. We perform a binary classification from all the distances that's collected and identify the valuation in the current frame. For this work, we adopted the human detection algorithm by Soton et al. That uses a single depth image to identify human body parts in object detection domain. And using that method, we can easily identify 20 body joints. The algorithm has been widely used by researchers for human activity monitor and gaming purposes. Each individuals were given a unique identifier based on their time of appearance on the sensor's field of view. For every person detected in the frame, the Euclidean distance between the center shoulder joint were extracted, and the extracted distances were compared with a given threshold value, TH, to find out if there were any violation present on that particular frame. And for a period of time, all the violations were calculated and we stored in the memory to determine the total number of violations that occurred in that particular period of time. The method was tested on a challenging dataset that we captured, with varying illumination and complex background, while people were working and conducting a group discussion. Here we enumerate the cases that we have observed. In figure A, 4 individuals were present in the frame and no violations has occurred, while in frame B, the 4 individuals were present and identified as red dots, while 2 violations has occurred and detected by the system. And in case C, 3 individuals were present in the frame and 3 violations were recorded as no one was following the social distance guidelines. The table summarizes the number of frames observed for each category, while the number of distance monitored to evaluate our proposed method. The proposed method achieved overall 98% accuracy on the dataset we recorded. Cases where one person was occluded, the shoulder center joint was wrongly identified, hence the accuracy was lower. And we can see that for walking, the person was occluded and some of the frames were wrongly identified as a violation, while no violation has occurred. And also happened when there is no violation, some of the frames were identified as a violation. We also translate our findings into a confusion matrix that shows that most of the cases, the results are rightly identified. A depth sensor-based approach is proposed for social distance monitoring. A depth image provides an efficient way to minimize the challenges faced by RGB images and improves overall detection accuracy. The proposed method achieved overall 98% on the dataset we recorded. By that, we reached the end of the presentation, and if you have any questions and answers, we'll be answering in the next session.